Okay, and we are live. We are just going to wait for the attendees to filter in.
Sure.
It does take a few minutes.
Okay.
A few moments, I mean.
No problem.
Okay, and I'm going to give it just a few more moments before we begin, just because I know there is a little bit of a delay when people are clicking their links. Okay, it looks like then that would be about it for tonight with the attendees, so we're ready to start. Hi everyone, my name is Laura Gramis. I am the Public Information Officer for Lehigh County. I am also the host for these weekly 2021 Citizen Academy webinars. If you have joined us before the past couple weeks, maybe you're familiar with the format. But what we do here is just try to educate the public and inform them of the role of the county government in different departments. And I just want to say sorry for the delay. Thank you for being very patient. Tonight's webinar is going to be on Cedarbrook. Before we begin, just want to go over a few guidelines. That today's presentation will focus on the history and role of Cedarbrook Senior Care and Rehabilitation. We ask that you refrain from all questions and comments until after a panelist is finished presenting. Any off-topic comments or questions will be withheld and will be prompted to move on to the next attendee. So just make sure you're staying on topic when it is your turn to ask a question. If you would like to comment on a topic tonight or ask a question, please use the raise your hand option to be recognized. If you're joining using the link provided on a computer or mobile phone app, you will need to click on raise your hand. If you're joining us tonight by telephone, you will need to use *9 on your phone to request to speak. The moderator will then unmute you and let you know you have the availability to speak. After the question has been asked, the ability to speak will be withdrawn. Other than that, I'm going to pass this off to Jason. Jason, the floor is yours.
Thank you, Laura. My name is Jason Cumello. I am the Nursing Home Administrator of Cedarbrook. I'm also here tonight with some of my leaders of Cedarbrook. Ms. Teresa Samuels is my Director of Nursing at Cedarbrook, responsible for the massive nursing department of Cedarbrook. Michelle Julian is the Assistant Administrator, and she keeps her office over at Fountain Hill and helps manage that large building over there. And also David Crook is on as well. He is the CFO and helps manage all our finances and money. So those are my core leaders that are on with me tonight. But I'll present. If there are any questions, I will defer to my experts, those three individuals, or myself as well, if I can help. Okay, so this is the Citizens Academy regarding Cedarbrook. And first, what is a nursing home or skilled nursing facility? It's long-term care for those that require 24-hour assistance with activities of daily living or constant supervision or disease management. It's short-term care for those that spent a lot of time in the hospital and need assistance with strengthening via therapy and/or disease management and/or other skilled nursing services. Also, in addition to the clinical level of care, there's all of the other support services, housekeeping and laundry, maintenance, social services, activities, faith services, volunteers, rehab, dining, and other support services throughout the structure as well. It takes every department working together and working effectively to run a facility. And Cedarbrook is a large facility. We're larger than many hospitals in the United States. All right, we're going to talk about the typical medical conditions of residents in a nursing home. Functional disability requiring 24-hour needs. And that's basically the general criteria of entering a nursing home. And any of the following conditions must be certified by a physician. who indicates those conditions necessitate 24-hour skilled care. You can see there's a variety of cognitive impairment diagnoses. The biggest one here at Cedarbrook is definitively the dementia. There's respiratory diagnoses, COPD is definitely a very large one. Cardiac diagnoses, like CHF, high blood pressure, and there's additional comorbidities as well. Pressure ulcers, dialysis, orthopedic conditions, etc. The people that live here in a nursing home or any nursing home in this area, but in particular here, parents, they're parents and grandparents. They lived their lives the right way and brought up good children. A lot of these people that live here were factory workers or steel workers, and those are the people that built the country and built the local region. The veterans, the people that served in the armed forces to protect our freedoms, and then all the wonderful teachers and nurses and doctors, professors, and the list goes on and on. But despite what you've done in life, you can't always plan for what life brings you later on. And truly, that's the case for a lot of people that live in the nursing home. So long-term care, it's split up in between different spectrums. Not only do you have the nursing home that we're talking about, but personal care and assisted living. Now, the nursing homes provide the most medically complex care. We also operate under the most stringent regulatory standards. And truly, we're one of the most regulated industries in the entire U.S. economy. And I know that's surprising to people, but it's the absolute truth. And skilled nursing, we have definitively higher staffing ratios than the next spectrums of care, assisted living and personal care. Assisted living can provide some of the same services here, but generally not at the same acuity level. And certain personal accommodations must be available in an AL bed. Personal care is often less personal accommodations than the assisted living. And skilled nursing services are generally not outlined in PC regulations, but they might be offered as additional services that people can buy in that type of facility. And in summary, the residents in AL and PC often can still maintain a higher level of independence and such, and they don't require as many services. At this point, Medicaid primarily pays for skilled nursing, but that may change in the future, regardless of any level of care. There are certainly great facilities out there at each level of care. I know this is a great one here at Cedarbrook, but there's other good ones as well. Rating nursing homes. Nursing homes are rated under STAR system. The STAR system is based on surveys. It's also based on, so the way it really works is it's based on your survey rating first, and then it can be adjusted for your staffing ratios or your quality measures. Your quality measures are really the metrics of clinical care. It includes things like falls with major injury, pressure ulcers, psychoactive medications, and a whole host of different criteria. So the system starts with the survey rating. It can be moved by the staffing rating or quality measure if either the staffing rating or quality measure are 1 or 5 star. A 1 star will more than likely drop your overall rating, and a 5 star will increase your overall rating. But it's not a perfect system by any stretch of the imagination, but it is a system, and it's not a bad one. Who pays for nursing home stays? There's of course private pay. People that have more extensive assets. This is not easy to pay for this level of care, and that's why most people are not in fact private pay. There's long-term care insurance out there. Makes sense for some people, but quite frankly, we don't really often see it. Medicare A, generally that pays for a skilled level of stay, generally after a hospital admission. And it's generally for the short-term rehabilitation residents, although our own residents can go to the hospital and our long-term residents and come back skilled, but primarily Medicare A is for the short-term residents. Same with managed care, has the same criteria as Medicare A. And then Medicaid it covers the vast majority of the population that can't pay for private pay, room and board. And you have to financially qualify for that. Realities of Medicaid is that it's really underfunded in this, at the state and national levels, and it's a reality of nursing home finance. And really, the way this works, and the only way this works, it doesn't work any other way. And the way the system is set up is that you have to have an X percentage of Medicare A and private pay residents to be able to supplement the care of Medicaid residents, because the government has chronically underfunded Medicaid. You have to make up margin elsewhere just to break even. It's the reality of things. It's why a lot of nursing homes specialize in short-term care. We do well with short-term care, but of course, as a county home, we're really here to take care of the Medicaid residents, and the good folks, through no fault of their own, but they just didn't take that level of finance later in life. And really, life is so expensive. Who can nowadays? So, and again, Medicaid is 90% of our population, and you can see the different criteria that's used for eligibility. The state requires the resident's income to pay for care as well, and that is a constant area of concern for a lot of families in any nursing home, is that the income must, by state law, still go to the nursing home, even if you're under Medicaid. So there are certain exclusions available for surviving spouses in the community, and or if the resident's deemed to be in a short-term stay. But again, Medicaid pays for everything, but the state requires that the income does pay for care. False stigma of nursing homes, misperceptions. It's where you go to die. They just leave you in the bed. Smells like urine, things like that. Those are really misperceptions. I mean, I've been at Cedarbrook for several years now. It's certainly not what we do here, and in my other homes that I've run in my career, it's not what we did there either. Generally people in this industry are in this for the right reasons. The reality is that it's where you go to live another phase of your life in an environment that's imbued with a sense of community and safety. This type of environment generally combats chronic social isolation among seniors. We're in COVID now, of course, but in normal times, it's it's a hub of activity here. It really is. Also provides a level of independence and security that many seniors just can't get at home or other care settings. Quality of life at Cedarbrook during non-COVID times. Now, of course, as we know, things are locked down pretty stringently at all nursing homes during COVID for obvious reasons, but during non-COVID times, we have a full, we have a full life enrichment department now as well, but generally there's a full entertainment schedule and all sorts of group gatherings and such. We have 3 chaplains that work our faith services department. It's very, very important. In normal times, we have a huge volunteer organization here. We generally have around 200 volunteers. We have active social services. We're very blessed here to be able to provide proper amount of social workers. It's really nice aspect of the nursing home. And we have long-term staff. That's very, very important. Very important to have people that have been in the building a while, understand the residents, know the residents. In normal times, I took some of these slides from the last time we did this. Normal times, it's nearly 800 in-house employees and 200 contracted employees. It's a little less than that now, but in normal times, this is a very large operation. Cedarbrook, Allentown, and Cedarbrook Fountain Hill. We're county owned. Of course, we're owned by Lehigh County. We're one of the 17 counties left in the state operating nursing homes. And really those counties are concentrated here in the east. Most of the Philadelphia region, the counties there, all but one have county homes. Our neighboring counties here, Berks and Northampton, have large county homes, and north of us, Monroe, and then there's a variety of homes on the western side of the state as well. But very much the largest homes are certainly concentrated in the eastern side of the state. The mission of a county home's very different than the mission of many private homes. We take care of highly complex dementia populations, and again, Medicaid populations, people through no fault of their own. They just don't have the resources at this point of their lives. And we take care of, generally in normal times, about 90% Medicaid population. In a non-county environment, no home could run that way. It's financially, it's just not financially possible to do that. And we're blessed that we can do that in the county environment. Staffing, we generally staff at greater levels than typical in the industry. Right now, we're rated as above average by CMS for our staffing. And right now, the CMS STAR system shows that we're above average in each category. Our quality of care is always highly rated, despite the challenges of taking care of a very difficult population of dementia. Is not easy to take care of, but we do it, and we do it well, and not easy to do that. Challenges at Cedarbrook that are very typical as well in the overall industry. We're adapting to a new reimbursement system, Medicare, PDPM, and again, this was an older slide, but we went through Community Health Choices, which is managed Medicaid in January of last year. Reimbursement's just very stagnant overall. So last year we did not get an increase for Medicaid, and that's not easy. There is, and I would love if there's some people out there watching this that maybe are looking for another profession or looking to start a profession. Maybe they're at the early stage of their career. There's a chronic shortage of nurses. There just is. It's here in the Lehigh Valley, very, very much so. The nursing homes feel it, the hospitals feel it in the area, and that's a national shortage as well. And COVID just exponentially increased that shortage. That is a struggle, and it's a struggle that we face, and I think we're conquering it every day, but it's takes a lot of work from different people, and particularly the director of nursing, who I indicated here, Teresa, and her team to recruit people, and there's a lot of people that started their careers much earlier and are at the tail end or retiring in the industry overall, and there's just not enough younger people entering it on the other end. And it's an equation that just is out of balance, and unfortunately, I don't see it coming in balance anytime soon. More medically complex residents, these places are becoming like geriatric hospitals. They really are. The residents that would be managed in the hospital just 10 years ago are now often in a nursing home. And a lot of these homes have very much aging physical plants. Again, with Medicaid funding being so low, it's hard for homes to invest in the nursing home. And the biggest thing over the last year now, we just passed the 1-year anniversary of COVID in nursing homes in the United States, where it started off in Kirkland, Washington. The pandemics really hit the elderly very, very hard. The nation really was completely unprepared for it. We really were as a country. We hadn't seen a pandemic of this scope for 100 years, and out of sight, out of mind, for sure. Early struggles in the pandemic nationally were with PPE, testing shortages, and just understandably at the beginning, there was just a lack of knowledge. It was a brand new thing, and our scientists and, around the country, our epidemiologists, they were just starting to study it, and things have changed often, especially the first 3 or 4 months. It was dizzying to keep up with all the changes. And that has waxed and waned since then, but it's still moving pretty quick. Study after study shows that when a local area has rising COVID cases and an outbreak, that translates right into the nursing home, and that's been true with COVID. Lehigh Valley was really hard hit in both the spring and the winter. I think in the spring the valley was hit because of our proximity to New York, which was an early outbreak area of the country. And again, the valley was hit hard in the winter. And when I say the valley, I'm essentially talking about Lehigh and Northampton counties. These two counties have had a higher per capita infection rate than most of the state, and even higher than the Philadelphia and Pittsburgh region. So higher per capita infection rate, what does that mean? The number of cases per 100,000 people. The area was it was hit hard. It really was. And again, that translates right into nursing homes. And, ultimately, many of the homes in this region were hit very similarly with COVID when you look at it on a per capita basis based on, the size of the building and such. When you normalize it that way, homes were hit very similarly. So we're in the midst of COVID. Sometimes it's been very difficult on the building. It's been difficult on the staff. It's been difficult on staff in all nursing homes. And I think there's going to be a lot of nursing home staff that carry a good amount of PTSD for the rest of their lives after going through this. It hasn't been easy. And so it's not always easy to see, what the future holds, but I still think the future is bright. When I was looking through my slides from last time, I looked at this one and I thought, you know what, I'm going to keep it because I still believe it. We have a large renovation project coming here. We just finished designing it. Maybe we have a few little details to polish off this week, but we have a 240 bed wing coming to the Allentown campus here. And we're already incorporating, I did modify this a little bit, I'm going to say for this slide, COVID research into HVAC systems for the new building and even the existing, believe it or not. We've already started that and looking at those studies that have come out since last summer. We have concentrated our CARES Act monies on that kind of thing, really doing what I would think, what society would want us to do here and trying to improve the building to be able to make it a safe environment. We have the Fountain Hill campus and Fountain Hill is a lot smaller than Cedarbrook, but in all honesty, it's a large skilled nursing facility in its own right. And, beautiful campus there, great staff, just as well as Allentown. And we're continuing improvements there as well. The community really cares about this place. The county supports it very well. We've dedicated employees, longevity, consistency, generally not found in healthcare. And because we're large, there's challenges with being large, and then there's opportunities. And the opportunity that we have is to leverage our size and economies of scale to find new ways to serve our community. And that's what we're going to look at. We always want to be a resource for Lehigh County. Admissions to Cedarbrook, you can contact Cedarbrook for a tour or admission inquiry. The tour is probably not going to happen anytime soon, but I'm sure it will sometime this year. You can see Jackie, our admissions director, her information there. The criteria is based on bed availability, clinical review, and financial and insurance resources. It hasn't been easy to admit people lately because there's a huge process. I know we've had to back up in some of those processes because it just to admit right now it requires a 14-day zone and all sorts of things, and it's just not easy. So bear with us. And then you can see the phone numbers for Cedarbrook Allentown and Cedarbrook Fountain Hill. And I'm going to stop my screen share here, Laura, as I completed that. And that concludes it.
Thanks, Jason. So what we're going to do now is we're going to open the floor for questions. So as I stated earlier, I'll briefly remind you all, if you would like to ask a question to the panelists, if you're on a computer or mobile app, use the raise your hand feature. If you're joining us today by telephone, please press *9. So now I'm going to open the floor to any questions. I'll just give it a minute to see if any come through. And again, I'd like to remind you all, if you're joining us tonight by computer or mobile app, to press raise your hand, so you can raise your hand to speak. And if you're joining us tonight by telephone, to press *9. Okay, this is the last call for any questions before I pass it off back to Jason. Teresa, David, or Michelle, if there's anything you would like to add to Jason's presentation, now is the time. Just simply unmute your mics and you can speak.
This is Teresa, Director of Nursing. I just want to reiterate, as far as Jason said, as far as Cedarbrook, it is a wonderful place. The residents are getting great care. I've only been there for a little less than 2 years. I've been in the healthcare industry for 25 years, and it is absolutely the best place I've ever worked. And I adore the staff. They are hardworking, they are determined. Even through the midst of the COVID, they have not given up and made sure our residents are well cared for. So I just wanted to kind of say that on behalf of the staff of Cedarbrook. Thank you.
Thanks, Teresa. Once more, I am going to open the floor to see if there are any questions. I also do want to remind everyone who is attending tonight that the PowerPoint that Jason showed us today, you all will be receiving a link to that PowerPoint starting tomorrow. You'll get a follow-up email. So in case you're taking notes or anything and you missed something, you don't have to worry about asking to see it again. You'll get a copy. It's also available on the Lehigh County website. And I also would like to remind everyone that this webinar session is being recorded. So if you want to listen back, if you missed something, it will be available on our YouTube channel, website, and Facebook page. So once again, I'm going to open the floor to see if there's any questions or comments. If you would like to ask a question on your computer, please press raise your hand. If you're joining us by telephone, please press *9. Okay, last call for any questions. Again, if you're joining us by computer, please press raise your hand. If you're joining us by telephone, please press *9. Last call for any questions for Jason, Teresa, David, or Michelle. Okay, it looks like there's no current questions from the floor. So Jason, I'm going to pass this off to you for final remarks.
Oh, well, if you have any questions and that I can possibly answer, feel free to, you can always give me a buzz. 610-336-5610 is my office number here at Cedarbrook. Otherwise, thank you for your time and attention, and hope you are well.
Great. Well, thank you again, everyone, for joining us today for this webinar for the Citizens Academy. Next week, we will be with Director of Human Services, Kay Achenbach. The link for that one will be going out shortly, either sometime tomorrow or next week, so please be on the lookout. Again, my name is Laura Gramis. I'm the Public Information Officer for Lehigh County. Any questions, you can always reach me through our social media channels or website. Other than that, that concludes tonight's webinar. Take care, everyone. Have a great night.